welcome to the deep dive. Today we're taking a shortcut into a really fascinating, pretty complex medical mystery. Vascular malformation syndromes. We've poured through a lot of material, detailed radiology reports, clinical descriptions, research to really pull out the critical insights for you. We want to help you understand these rare conditions. They're, much more than just birthmarks. Think of them like intricate puzzles the body sometimes creates. Okay, let's unpack this. Right. So first things first. I think our first crucial nugget is getting clear on the difference between vascular tumors and vascular malformations. I mean, it sounds like semantics, but it's not just a technicality, is it? It seems to dictate pretty much everything that follows.
Oh, absolutely. It's fundamental. The International Society for the Study of Vascular Anomalies, ISSVA, they classify these based on cell behavior. So are the cells actively proliferating, growing rapidly, like a tumor? Think of an infantile hemangioma. You might see a raspberry red lesion, which has grown and enlarged rapidly, maybe after birth.
Okay, so that's the tumor side.
Exactly. Or are they essentially malformed channels? These are abnormal blood vessels present right from birth, and they just grow proportionally with the patient. Like a venous malformation, perhaps described as a blue swelling, soft to palpate, which has been present since birth and grows as the boy grows.
I see.
And that distinction, it changes the whole approach, diagnosis, treatment, everything.
That clarity really is key then. So knowing that fundamental difference, how do we start teasing apart the specific malformation syndromes? Let's dive into some of these, the ones with unique clinical fingerprints.
Yeah, good idea. Let's start with Klippel-Trénaunay Syndrome, or KTS. This one has a classic triad of features. First, a port wine stain, that reddish-purple birthmark. Second, you have atypical venous and/or lymphatic malformations. And third, there's overgrowth of soft tissues and bones, often just in one limb.
One limb, typically.
Often, yes. And it's considered a low-flow malformation. It's primarily linked to somatic PIK3CA gene mutations.
Okay, low flow for KTS. Now, here's where I found it gets really interesting, especially comparing KTS with Sturge-Weber Syndrome, PWS. They can look similar sometimes.
They can look superficially similar, that's true. But PWS has a critical and potentially dangerous distinguishing feature: high-flow arteriovenous malformations, AVMs.
High-flow AVMs.
That's right.
So what does high-flow actually mean for the body? Why is that distinction so significant compared to KTS?
Right, that's the absolute key insight here. KTS is low-flow blood, moves more slowly diffusely through those malformed channels. But PWS involves high-flow AVMs.
Yeah.
These are direct, rapid connections, shunts, between arteries and veins.
Ah, like a shortcut for the blood?
Exactly. And this fast shunting, often caused by a RSA1 gene mutation, forces the heart to pump much harder to keep up.
Yeah.
So the critical implication here is a significant risk of high-output heart failure. That's a severe complication you just don't typically see in KTS.
Wow, okay.
Which is why imaging like Doppler ultrasound and MRA is absolutely paramount. You need to identify those specific high-flow shunts.
That makes sense. So, moving from the limbs, let's shift focus to syndromes affecting the head and other critical organs. We have Sturge-Weber Syndrome, SWS, involving the brain and eyes.
Yes, SWS involves capillary venous malformations. You see it on the face, that characteristic port wine birthmark, typically on the forehead or upper eyelid distribution. But crucially, it also affects the brain and the eyes.
And there's something specific about imaging signs here, especially early on.
Right, this is a critical insight for diagnosis. SWS is quite famous for these tram track calcifications you can see on brain imaging. But here's the catch. They typically appear after the age of 2.
Oh, okay, so not in infants.
Exactly. So early imaging, particularly MRI in infants, might look normal if you're only looking for those calcifications. Radiologists need to look for other, often subtler signs, like leptomeningeal enhancement. Otherwise, you could miss it.
And this one's linked to a GNAQ gene mutation.
That's right, a somatic GNAQ mutation.
Okay, so Sturge-Weber is more localized in its primary impact. But some syndromes seem much more widespread. Let's talk about hereditary hemorrhagic telangiectasia, HHT, also known as Osler-Weber-Rundu disease. This sounds systemic.
It absolutely is systemic. HHT is an inherited condition, and it's primarily known for, two main things: recurrent nosebleeds, often quite severe, and AVMs developing throughout the body.
Throughout the body. Where specifically?
We're talking critical organs, lungs, brain, liver, the GI tract, pretty much anywhere. And the major takeaway here is that these widespread AVMs, which stem from genetic mutations in genes like ENG or ACVR1, They can cause really serious problems. Think chronic anemia from GI bleeding, or even stroke if AVMs are in the brain or lungs.
So genetics are key here too.
Definitely. Genetic testing alongside comprehensive imaging is really crucial for diagnosing HHT properly and managing it proactively.
Right. Now, for something quite distinct, Maffucci Syndrome, what's the unique combination we see here?
Maffucci is sporadic, not typically inherited, and it has this very unique combination. Multiple benign cartilage tumors called enchondromas and soft tissue venous malformations. And often within those venous malformations, you can see these little calcified thromby blood clots, basically, called phleboliths. You can sometimes even spot them on a plain X-ray.
Enchondromas and venous malformations with phleboliths, that sounds quite specific.
It's highly specific. But the most critical aspect of Maffucci syndrome, which is linked to IDH1 and IDH2 mutations, is the risk. There's a significant risk of malignant transformation.
Malignant, so cancer.
Yes. Those benign cartilage tumors can transform into chondrosarcoma, an aggressive bone cancer. And the venous malformations can sometimes become angiosarcomas.
So close monitoring is essential.
Extremely vigilant, lifelong monitoring is absolutely required.
Okay, finally, let's touch on blue rubber Bleb Nevus syndrome, BRBNS. I mean, the name itself is quite evocative.
It really is descriptive, isn't it? It refers to these multiple soft, compressible venous malformations on the skin that look like, well, blue rubber blebs.
But the skin isn't the main concern here, is it? What's the hidden danger?
That's right. The skin lesions are obvious, but the hidden danger, the most crucial aspect of BRBNS, which is caused by TEC gene mutations, is that these same blebs occur inside the body, particularly in the gastrointestinal tract.
Ah, so internal bleeding risk.
A very high risk, yes. Recurrent hemorrhage from these GI blebs can lead to severe chronic iron deficiency anemia. So imaging, maybe like endoscopic ultrasound for the GI tract, is vital to find these internal lesions. They might otherwise go completely unnoticed until a major bleeding event happens.
Wow, okay. So let's try to synthesize this. What does this all mean? We've gone from the basic classification tumors versus malformations right through to specific syndromes like KTS, PWS, SWS, HHT, Maffucci, and BRBNS, looking at imaging clues, genetic links.
Yeah, and the underlying flow dynamics, the specific risks.
Exactly. It's clear that really understanding these intricate details is just paramount for getting the diagnosis right and tailoring care for each patient.
Absolutely.
Our journey today, this deep dive, it really highlights the incredible complexity of the human body, doesn't it? But also, I think, the remarkable detective work that goes into modern medicine to figure these things out. So thinking about all this, what patterns or connections or maybe even questions does this spark for you? You know, considering how these tiny genetic changes or developmental errors can lead to such profound and really varied effects across the whole body, it's quite something to think about.